if you can, please type in the chat group. Hi, Gray. Farah with Justin. We have Winnie. Good. Not sure whether people still come in. Quite a lot of people register. We give them another 2 or 3 minutes to come in. And then can you hear me properly? If you can, please type on the chat group, say yes. Great. Great, Justin, thank you. Thank you, Farah. Thanks. Right. Today's topic, right, it's kind of very easy. So what I'm going to do is, because this easy but super common, complicated in a way because you guys see in every single day with the different manifestations. So today we're going to talk about in a very practical way of recognizing what is the real flu, what is allergical, what is just a normal sneezing. All right. Great. Let me share my screen. I will be looking at the chat box as well. So in between, as I'm talking, right, do feel free to put in the chat box your question. I will try to answer it if it relate then. If not, then I will probably answer it after the class, right? Okay. Now, some housekeeping rules. So please mute your microphone. And then when you have query, please note down the question in the chat. I'll probably have to drink on and off. Today is a whole day of work. And I think that's all that we have to tell you. I think you guys are quite quite good at doing this webinar already. Okay, first of all, thank you for logging in even on a Saturday night. Usually we do this on Friday night. I'm very sorry we have to change it to Saturday night this time. It's because yesterday we have another talk for Foreigner. Foreigner is an international group for pharmaceutical. So we have a talk with the vet about mental health. So I think we vets are like you guys as well. That how to say that we that will be very sad losing pets that we love and patients that we care. All right. So I think those people that sign up probably forgotten today. The class is today. I think I will go on with the class, and if they come in, we'll just admit them in later. All right. Otherwise, it will be just 10 of you. Great. Can we start now? If you are ready, then just type in 99 for me. Okay. Great. Now, as you guys know, I'll still have to do this every single time. Our vision is to be this #1 pet health academy in Malaysia, and definitely our mission is to educate as many pet owners as possible, so that you guys can be their pet hero. So a lot of this recognition of early symptoms is going to help them a lot. All right. Now, What happened is cat flu is a very general term for very highly contagious upper respiratory tract. Upper respiratory meaning from the nose to the sinuses to the trachea to the trachea to the upper bronchi is what we call the upper respiratory tract. Anything from the bronchus and below to the lung is the lower respiratory tract. Okay, so flu is always upper part. All right, and how do you know your cat is having flu? So usually they will be sneezing or sniffling. What is sneezing? Later I'll be showing you some video of sneezing. So today, usually what we'll learn is cat having flu all the time one, right? So how do you as a person or a caretaker or a owner that has more than one cat to actually help to prevent other cats from having it if one of your cat is having flu? And how do you recognize, right? Most importantly, how do you recognize this one is memang contagious flu and the others are not? To be very, very frank, itu doktor pun maybe tak tahu kalau you go to the clinic right away and say, hey doctor, this is contagious or not. Most of the time for us, flu are pretty contagious. Okay. I just want to check with everybody. Is it okay that I'm using English? Or if any one of you, because the other day when we go to the cat show, there's quite a lot of our Malay friends are telling our staff that if it is in Bahasa, then they will be able to join the class. And then we promise them that the speaker, which is me, can also speak Bahasa. All right. So whoever that need me to speak in Bahasa, please let me know. Don't be shy because it's just language, right? Whether you can or cannot understand English is not too much different from understanding from Bahasa. Okay. I'm very proud that my Bahasa is very good. I think, Farah, please let me know whether my Bahasa is good. It's about the SPM says so. My Bahasa SPM A1, okay? So I hope the SPM is giving us good thing. Okay. Who else? Let me see. Afrina. Okay. If you need me to speak in Bahasa, just type in the chat group or tell me, explain again. I'll do it again for you. Okay. I'm very, very good at it. Okay, great. So when they are sneezing, right? One thing that you need to, thank you. Great. So it'll be English all the way. So when they're sneezing, you want to know, or I give you some little tips to know that whether they are just because your aircon is a bit cold, then they sneeze, or they play with something, then they sneeze, or the allergen. Say for example, we use a lot of sanitizer, right? We at one point of time we do have cats that keep coming in for asthma and also sneezing because of sanitizer. We didn't realize it until a bit later when we keep asking, why is it? Then give the flu medication, blah blah. When it's on flu medication, it's better. When it's not on antihistamine, it's worse. Then later on, we found out that it's actually the sanitizer. So we make the owner stop using the sanitizer inside the house, and the cat is okay already. Okay. So this is something that you can look at as well. And then I'll try to keep this talk as short as possible so that I can take a lot more of your question. Okay, any of your full question. Now, this slide is the one, right, that I'm going to, you can actually take a photo of this slide. So first of all, number one is herpes virus. Herpes virus is always the one that causes sneezing, that is having a little bit of serous nasal discharge. Serous meaning transparent, no color. Okay, when you see your cat having no color, transparent nasal discharge, is usually herpes virus. Sometimes they have very bad or bluish color eye. It is quite typical. Then second most common one is the feline calicivirus. Calicivirus is a bit bad. Calicivirus cause not only eye issue, nasal discharge, but it also cause a lot of oral ulcer. So if you always see a cat that has ulcer behind on the tongue, kitten, when you rescue the kitten, when you see the ulcer on the tongue, most of the time is because of this calicivirus. Okay, and then third is definitely allergen. Allergen, like how I tell you, your what is this, your sanitizer lah, dust, when they hiding on under your bed, and then when they come out, then they get this sneezing. It could cause allergy rhinitis as well. Sometimes they will also have discharge. Usually, if before they have this secondary infection, meaning it's only allergy, just a little bit of transparent discharge. That's all. And then after they sneeze it out, usually they'll be okay. Or after 1 or 2 doses of antihistamine, they'll be okay. All right. Number 5, okay, number 4 is chlamydia. Chlamydia is also the one that you always see in kitten with greenish color discharge usually. And also it causes a lot of oral ulcer. That's what chlamydia do. And then number 5 is stress. So to be very frank, what you need to know to categorize is just these 3. So the 2 viruses and then the chlamydia. So usually, sometimes in the internet, they call it FURD, is it? Feline, sorry, FURD, feline upper respiratory tract disease, or feline viral rhinitis. All of this name, right, is actually just to tell you that, okay, it's the virus or the chlamydia that is causing this issue. So no significant in it lah. Okay, don't really have to know. And then second thing that you need to know is because of allergen. So try to find out what are the allergen that your cat is allergic to, and then remove the allergen, then got it. So number 5 is the stress. Stress usually is because new cats at home, moving house. There's one case is so funny. Husband and wife get married. Husband has cat, 2 cats. Wife has 1 cat. And then when the wife cat moved into with the husband, so 3 cats are together, and then the cat gets so stressed and keep falling sick. And once we deal with the psychological part of it, which is, the slow introduction, the smell, and then getting them to know each other, different kind of territory, when we put that all up, then all 3 of them have no problem already. So we have also the psychologist for the cat, okay? So far, if everyone is okay, can you type a yes to me, or okay? Type an okay to me to tell me that you're okay. Thank you, Angela. So simple, right? Thanks, Farah. Okay. So this is to tell. Not this one. Not this one. Sorry. The one is so big because okay.
I know, doctor, you have to read this time.
No, I actually wanted just this. Wait, yeah, I'll let you guys know which one that I wanted.
You have to read it.
Wait, sorry. I'll is all this meaning. Sorry, you give me a.
You stop sharing and go near me. You know,
诶，这个来的，
不是。
I think it's just here somewhere. Sorry everybody. It's not. Open.
Sure, sure.
Oh. Okay, do it one more time. Can you do it one more time? You want to share it before you can. Okay. Hope you can this sorry, watch again. I want you to notice this cat, right? Okay. If your cat, thank you. If your cat is sneezing like that, meaning it's just because of a little bit of irritation or cold, then they sneeze like that. Okay, it's just like all of a sudden they play with something and then just achoo. That's all. So that is one of this. Okay. Okay, this is when you see that when you have viral or discharge sneezing, they sneeze, they will try to clean up their nose. So they either clean up with their tongue or they clean up with their hand. Okay. I want to ask you this question, okay? Who can tell me in number 1, 2, 3, 4 that I share you just now, right? Which is the one that you think that will have this issue? What kind of flu, what kind of things that is causing this, that they will sneezing like that and have to their nasal discharge. Okay. Okay. Is sorry, is this one? Tell me whether which one is this? You can choose more than one. For the ginger cat just now, they're actually doing this and then to lick their discharge. Which one of it can cause it? 1, 2, 3, or 4 or 5? Which one do you think? It can be more than one, okay? It can be more than one answer. Very good. Yeah. So usually, yeah. Anyone? Any more? Come. It's okay to not answer it correctly at all. No give anyway, but for self-satisfaction. Now, so like I told you, right? This flu that is caused by viruses and also bacteria, they will actually cause a lot of discharges, and then they will always have to clean it up. Okay, and usually 1, 2, 4 will have this. Even though the allergy rhinitis sometimes can do this, but initial allergy rhinitis wouldn't cause this, because the first initial allergy, right, when they first get the allergen, they will just sneeze it out because they want to get the allergen out of the body, right? So then later on, when more irritation is there, and then after that, because of the discharge, the viruses or the bacteria start setting in, then you will have a lot of these discharges from. Okay, so the one that you can actually use nebulizer to actually clear the issue, usually they don't really have discharge. So technically 1, 2, 4 is the right answer. Who gave me the right answer just now? I see. Oh, Angela. Great. Actually, generally, generally all of you give me the right answer. It's just whether complete or not. Okay. Now I want to show you, right? You see this cat, this cat is trying to play with some tepung. See what happened. Okay.
Too much? Guys, kita 역시 건축 중간에 저렇게 찍고.
See? So what happened is he plays with it, the tepung come out, so he's not sneezing. So when they sneeze, right, they just want to try to get that thing out. It's just like how the powder gets to us, and then we want to sneeze it out. That's all. Okay. Now I want to show you another one that is more dramatic lah, more dramatic. It plays with the box. Okay, who I know you guys are off, you are not on your camera. So whoever that actually laugh at this, please type 99 for me. Those that didn't laugh, press 0. Come, tell me. Gonna run one more time for you. Who that is laugh? Don't lie, don't lie. Who that is laugh? Who 99? Who doesn't laugh? 0. Okay.
What finish?
So did you realize that when we have the irritation, they want to try their best to actually sneeze it out, but it doesn't go like this and like this because they don't have to really clean up their nostril. All right, great. Only 2% think that it is funny, or all the other 3. Okay, all the other 4 asleep already. Right. So when they have this issue, right, what are the symptoms that you would be able to see? Okay, is when they have breathing problem. How do you know that is breathing problem? Put in the chat group and let me know. How do you know that? How do you know your cat has breathing problem? Okay. Second is fatigue. Fatigue means very letih lah, like really like tired. Don't want to walk. Don't want to stand up. Don't want to play. Called fatigue. Sneezing, everyone knows what sneezing. Come tell me how do you know your cat is having breathing problem? It's okay, you all must answer me so that we know how to tackle and help to know whether you understand or not. Okay, loss of appetite, okay, for sure. Coughing, I want to tell you, right, coughing is very difficult because cats seldom cough. And when cats coughing, you have to be a bit more careful to try to find out what is the reason behind the coughing. Sometimes it's because even a heart issue. Okay. So Justin say labored breathing. Can you elaborate? What do you mean by labored breathing? That means, how do you know that cat is labored breathing? Okay. Noisy breathing. I think what Kay is trying to tell is that when they breathe, it has either sounds like, right? That is what we call wheezing. Okay, wheezing. Can't really find YouTube video on that. So either that or when they are breathing, it goes like, yeah. Okay. Great, Justine. Thank you for explaining. The whole abdomen heavy, go up and down. All right. Usually when you see your cat breathing, right, it's always on the chest. Okay, it's always on the chest. So when you see abdominal breathing, it's already something not right. But labored breathing, usually, let's say if after they play and run, then they have this abdominal breathing or labored breathing, it's quite normal lah. But when they are sleeping, you see them that the abdomen is up and down, then it's something very, very wrong. Breathing with heavy sound. Yeah, just now I've already explained. Open mouth breathing, great. Thank you for bringing this up, Angela. Open mouth breathing is a very, very bad situation in cats. Okay, cats. So open mouth breathing meaning to say that there are two ways. Today I just talked to this morning. I've a talk in this MNAWF, the foundation for animal welfare. So what I was telling them is when you have open mouth breathing like panting, cats seldom pant. But sometimes when they have heart issue, or sometimes when they have breathing difficulty, or they are really hot, that going into his throat, they might have panting like dog panting. Some of the cat, brachycephalic cat, that means flat nose cat, like British short hair or even Persian, then you will have this panting. Okay, but the real open mouth breathing goes like that. I put myself up. Stop share so that you can see. Called open mouth breathing. So when they do that, especially when they don't have enough blood, that means they are very pale, very anemic, or very painful, or they are very weak, like going to bye-bye, then they will have open mouth breathing. So when your cat normally don't have open mouth breathing, then now it's not panting but having this open mouth breathing, don't think. Don't wait tomorrow. Don't wait 2 hours. Go straight to the vet. Go straight to the vet. Okay. Call your vet and tell them that my cat has open mouth breathing since when and when, so that they will know, they will get the oxygen cage ready, so that when you go there, they can straight away put into the oxygen cage. Okay. It is very important. How about real sound while breathing? Real sound, I think, is what I've told just now, right? I think like I tell Kay just now, I think it's wheezing. That's what you mean, like like that, right? Wendy, if it is correct, you just say yes. If that's the case, usually it's because of allergy rhinitis, or yeah. Wendy, why don't you unmute yourself and tell me what do you mean? Wendy? Wendy, you raise your hand, right? You want to say something? Please do. Okay. You can unmute yourself and elaborate if you want. We have actually tried to unmute you. Bubbling sound is bad. If you hear over the lung, right, and has this, probably not bubbly, it's like cracker sound, like crack 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 crack, crack like that, is something not right. Crack 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 like that. Usually, if we listen with the stethoscope, the crackling sound is actually like bronchitis or pneumonia will have that kind of crackling sound. Okay, or even sometimes a very early stage of pulmonary edema. That means the lung has water, also can actually sounds like that. Okay, since we unmute you and you do not want to talk, we'll just continue, yeah? Okay, Wendy? Right, that's the symptom. What else? So when they really have infection kind of it, like I told you, like what is this, chlamydia, this upper photo, it's very typical of how a chlamydia infection look. You always see it in the kitten, especially the rescue one. Okay, I don't know whether you deal with a lot of rescue cases. This is usually what happens. And this calicivirus and also chlamydia also cause this ulceration on the tongue. So if you do see these kittens or cat or your own, you can actually open the mouth and check on the ulcer. Okay, great. All right, treatment. What do we do? So usually what we do as vet is actually just to relieve the clinical sign. Meaning, if sneezing, we give antihistamine to reduce the sneezing. Okay. And then if we see a lot of eye discharge, infection on the eye, like conjunctivitis and all that, we will be giving you eye ointment to do it. And then sometimes the nasal discharge is so bad, sometimes, quite rarely, that some vet will give you a nasal drop as well. Okay. And then what else? If the ulcer is really bad because they can't eat properly, then we'll probably give some very, very soft food for them to eat. So relieving clinical sign for flu patient, and just that's all. Don't really have a direct cure. Why? Because you, as you can see, right, from there, whatever 5 things that we have in there, other than chlamydia, there is none really have a direct cure to it. Like viruses, you don't have antiviral for this herpes virus and calicivirus to kill the virus. You don't really. Okay. And then chlamydia, we do have antibiotic to actually take care of it. And then the allergical rhinitis, also you don't have anything that direct to it. And then the stress as well. So for stress, what we do is we put them on immune booster. So we boost their immune system and help their own body to build up their own body to clear the infection. Okay. Other supportive treatment, like when they don't eat, when they have so much of ulcer, so what we have to do, we have to put on drip. Okay. Sometimes in some cases, we do use antiviral medication, especially in cases that have leukemia and AIDS. Okay, leukemia and AIDS. You know, in leukemia patient or AIDS patient, right, or FIV patient, their immunity is low. So sometimes we will do antiviral for FIV patient. All right. Eye drop, like how I tell you, and then antibiotic for secondary bacterial infection, meaning to say that when they have allergy, at first, they won't need anything, just antihistamine. Okay. When the disease progresses, then it becomes the secondary infection that comes in. All right. Like bacteria will start coming in. So then the doctor will start giving you antibiotic. Okay. Nutritional support, like what I tell you, because of the ulcer and all that, difficult, so you have to use strange food. And then please find the allergen. If you can see, I show you the video, right? You can actually differentiate what kind of how to say sneezing it is. If you suspect it is allergen, please try to find what is the allergy cause of this flu. Okay. And then I'm not sure whether you guys have any experience in using nebulizer. Anyone that is here who have experience in using nebulizer, please type 1 for me. Those that have not used at all, please type 0. Right. Wow. So Angela, your cat has allergical rhinitis. If you want, you can. If you don't want to type, you can actually unmute, and because it's a small group of us, you can actually unmute and let us know. Right. Okay. So what we do with nebulizer, Afrina, have you used nebulizer before for your cat? Farah, have you used nebulizer for your cat before? Never. All right. Great. So what nebulizer does is that, like human, when we have allergical rhinitis, or when we have especially allergical rhinitis, when we have flu, there will be a lot of nasal congestion. Okay, nasal congestion. So when you see this nasal congestion, right, we want to break it up before we actually either sneeze it out or swallow it in. Okay. And when we are doing that, the whole airway will be very, very inflamed. So imagine there's a pipe, there's a windpipe. This is the windpipe. So what you do is when you have upper respiratory tract infection, the trachea and the upper bronchi, right, will be inflamed. So when they are inflamed, This is the whole of it, right? This is the whole. When it's inflamed also, not only it's inside. So when it's inflamed inside, so it becomes thicker, so the hole becomes smaller. So that is the time usually that you will hear all these noisy sound, all these wheezing sound, hard sound that you see that you hear, because the air is going through a narrower pipe. Okay, so so you need to know. So you need to know how can the cat flu spread. Why? Why? Because you have more than one cat. Who has only one cat? Type 1. Or whatever number cat that you have, please type it in the chat box for me. Please. Wow. Farah. Wow. Okay. What are we dealing with now? How do you take care of 18 cats? Okay, Farah, so you have to pay extra attention, yeah, Farah? Because I tell you, if you treat one cat, if you have one cat that has flu, then you probably have 18 cats that have flu, okay? So I really need Angela and Farah to pay attention. And then before I proceed, I would want you and Angela to have an area or an enclosed area or a smaller area for you to have it as an isolation room. Okay, you have to get it ready today. I like now, not now, but you know, in these 2 days. Why? Is because yeah, thank you, Angela. You need to have an isolation room because when one of your cats, so pay very, very close attention to all your cats. So when one of your cats starts to sneeze, if it's not start like how the first video is, it's just like, play, achoo, then it's fine. So when you see your cat start doing this, isolate him right away. Why? Because the nasal discharge is where the viruses are, okay? Even though it's clear, even though not yellow and all that, yellow is the one that is secondary infection. So usually like how COVID come to us, we clean with the hand, right? Then what we do? Then what the cat does? The cat walk all over the place. The cat walk your whole house. And when your cat walk your whole house, you tak sempat nak disinfect. Ta-da! Then you will see one after another, right? That is going to have that. Is it very true? Do you guys have this kind of experience? Can you tell me? So cat flu is generally spread by direct contact. Okay. Thank you. Experiencing, alamak. Okay. So what I can help you is, Farah, if you are experiencing it now, then whoever go and actually check every single one of your cat. Check their eye, check their nasal discharge, check their mouth, and then categorize them as those that is have clear discharge, one. Then those that has already like all these yellowish discharge, another room. And then those that is clear, another room. Okay. And then what you do, because the tear and nasal discharge is the one that actually easily spread. So what you do when you clean your own house, clean the one without issue first, okay? And then please disinfect them even though they don't have issue. Because sometimes your other cats has already spread some on the floor. If you don't keep disinfect those area, right, then you might have problem. Okay, what you can do is you can do for house and flooring, right? You can do formaldehyde or chlorine based kind of cleaner. It's more economical for sure, because the when you do chlorine based, what you will have to do is I would suggest the most concentrated one is about 1 part to 30 part of water. That's the very, very concentrated one. Once you use that, right, you have to actually clean it up another time with clean water or plain water. Okay, they can survive very, 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 very long, very long. Different type of virus survive differently because they are viruses that is with envelope and without envelope. It's too much for me to explain it here, but virus can actually stays up to many, many hours. Okay, so whoever that is in the same household, that is the reason why when you are outside contacting this COVID cases, right? Then it's so easily for you to spread from one to the other. All right. So you check them, and then one part of water to one part of Clorox to 30 to 40 parts of water. Please measure it carefully. Yeah. With this measurement, actually the concentration is very, very strong. Within 10 minutes, all the virus will be bye-bye. Okay. Whether now talking about it, even if it is panleukopenia, the so-called parvovirus, would actually be killed by this as well. So what you do, you spray all the cages, the flooring and all that. Keep all your cat away first, please. Keep them in at one side, or in some cages one side, and then clean up all the place. Then only put them out, and then after that clean the cages, and then you put back them in. Okay. So when you clean up, after you have sprayed, leave it on for about 10 minutes. Okay. Once 10 minutes, mop it or clean it up with plain water again. Please don't let your cat standing on those areas that you have sprayed your Clorox, yeah. Otherwise, you will end up with a lot of corrosive problem on the skin and the paw as well. Okay, yeah. Anyone please understand what I say? Say, put a 99 for me. If you don't understand, please ask. I really need you to understand this. Okay. When you isolate them, isolate until the no more nasal discharge. About 5 days without nasal discharge, 3 to 5 days after they don't have nasal discharge, you can actually bring them out. But make sure your other cats are first well vaccinated. Second is your place keep cleaning. Okay. Parvo positive, you need to quarantine 2 months. Technically, if you really want to do that, your flu cat also have to do that. But usually what we will do 1 week should be good enough. Okay. After no more nasal discharge, not when it starts, how to say, not when it starts the symptoms. When there's no symptom at all, on the day you start to count 1 more week. Okay. If you're very, very careful, 10 days should be good enough as well. Okay. Panleukopenia doesn't really spread that long, but the issue is, I think they are worried about your other cat that is not being vaccinated properly. I think that's all. So even if you have this so-called parvovirus, right, or panleukopenia virus, use the same dilution to actually clean up the place. After 10 minutes, clean it up with what is this? The plain water. Okay. If you only have a very small space and you don't want to do your Clorox, little bit of advertisement, no, you can actually use the paw spray. But paw spray for your whole household will be very, very, very expensive. So don't do that. Use the Clorox. If it is only one small cage or just the bedding and all that, and you have only 1 cat, you can actually use paw spray as well. But the paw spray also the same, have to leave on 10 minutes, okay? Because only after 10 minutes then the killing is done, okay? So it can also spread directly from the food bowl or water bowl, okay? If your cat is having problem, please don't let them share the water bowl and food bowl anymore. Keep them in the cage. Don't kesian and put them out, okay? Put them in the cage, put in the isolated area. If you don't have an isolation room, never mind. Put them at the kitchen or one of your toilet, okay? Then your bedding, your litter tray, and human hand, and definitely the paw. So after you handle them, so let's say like how I told you, right? You have the one with a clear nasal discharge, another one have the yellow color nasal discharge, and then another that has no symptoms, right? Do with the no symptom first. Okay, and then do the virus one, do the clear discharge one, and then only do your yellow color discharge. Can you please write it down for me? Clear, sorry, no symptom, number 1, clear discharge, number 2, yellow discharge, number 3, yellow or green discharge, number 3. Come, everyone list it down, please. I'm trying to be a teacher now. You know why? Because the way you, after you explain it back to me, or after you write it down again, it will go into your brain more. Okay. Why are we doing that? The reason behind it is like the one that has no issue, right? You disinfect them first. Second, you disinfect the viral ones first because you don't want the bacteria to come to your virus cat. Okay, so you clean the virus cat first. The second one that has already have yellow discharge means they already go through the viral infection and now they have the secondary infection. Okay, makes sense? I really hope that you don't have to do this, please. Thank you so much. You guys are such a good student. Thank you. All right. Yeah, okay, I'll leave the vitriol antibiotic a bit later, okay? Now, after recovering from cat flu, okay, many cats remain this thing called lifelong carrier, okay? So the virus will stay in their body. They usually don't show sign or show very, very little sign. Like sometimes when they're really like stressed out for a little while, then they will start to sneeze. And then when they sneeze, they also pass to other cats, but they don't get very sick. Okay. The cat that actually carrier, they don't really feel very, very sick. They just keep passing the virus to the others. Okay. So when you see this carrier, you also isolate them when they have symptoms. Okay. When they don't have symptoms, you can actually keep all your cats really optimum health or optimum immunity. Then they don't really get this virus from this so-called carrier. Okay. Sometimes they shed virus during their stress or especially in shelter or boarding. All right. So how do you do preventive care? Oh, wow. I see. I want to keep it short. Now it's 9:20 already. Okay. Preventive care, I'm going to be finished soon. Okay, preventive care is, first of all, vaccination is very, very important. So inside vaccination, you already have this herpes virus, chlamydia, and also calicivirus. All of these viruses are already included in your 4-in-1 vaccine. Okay, your 4-in-1 vaccine will protect you against all these things, but not every single cat flu vaccine doesn't include every single cat flu strain. Okay, but it actually take care of most of it already. All right, and then regularly disinfectant your place, like how I tell you, your litter tray, more and more important, especially those people that actually have more than one cat. All right, and then when you really want to bring in a new cat, please, when you want to rescue a new cat or bring in a new cat, even though they look very, very well, isolate them for 1 week at least, 1 week to 10 days, okay? And then maintain good immunity. So what you can do is you can make sure they eat well. So nutritional, how you maintain their good immunity is nutritional wise has to be very good. And then your environment has to be very good, well ventilated and all that. They don't get stressed, that they don't keep fighting with their friends or other cats or people that they don't like staying. And then definitely you all can put in some immune booster, things like lysine, and then vitamin B complexes, DMG, animal straf, even sometimes what else that can actually do very well in some cases of multivitamin can also be very good, okay, to bring up the immunity. and then do identify the allergy factor, because we do see a lot of cases that allergy to what is this those essential oil dispenser. Some of the cats some of the patient are allergic to those very, very expensive one also. After we found that out, right, the owner was so angry. But anyway, she was very angry and also very glad that we found that particular thing as an allergen, because the cat was having so much of difficulty. She thought that actually that thing will help her soothe the symptoms, but actually it make it worse. So when she removed that thing, the cat is so much better. Okay. And then other things like sanitizers is another one of it. Dust. Or another thing that kitten always have problem is sometimes the cat sand. Sometimes some cat sand that has a lot of residue, they also have problem with that. If they have problem with the cat sand, you can actually choose to change to those crystal one, the tofu one, or even some of them use that wood shave. But the wood shave, some cats also after the wood shave have contacted with water or urine, right? It actually become powder form as well. Some of my cat patient are allergic to that as well. Okay, so I think we are quite done with this. I will take your question. Okay, before I take your question, allow me to do the usual advertisement. All right, just to tell you guys about our membership. So not good in doing this, but the gold members will be about 50 ringgit, and then you can enjoy all this thing, and then you can definitely come for the talk. If you like, please scan and click this. This is our platinum members, which worth for a year. You can come for like 6 times of the talk, and then they also give you some members what is this kit, which have the paw spray and the DMG, and then it's also can be one of our WhatsApp. We do have WhatsApp group, right? We do have WhatsApp group as well. We do able to help some of our members because one of them I think went for holiday, and then they encounter issue, and then at that point of time I was actually in the conference, emceeing for a conference, and then because they have our contact number, they are able to contact us, and then we are able to also talk to them a little bit about it, and also they help to find this vet that is very near them that actually help. Okay, so that's all. So great. Now I can answer your question. So whoever that wants, I can. All right, thank you, Joey. You can just click on the link to join lah. All right. So for the question of Baytril is actually enrofloxacin. That is the reason why, right? Not only Baytril, we have a lot of problem of people thinking to save some money, because I mean, we can understand very well, Angela and even Farah, that when you have 18 cats, right, you cannot be bringing your 18 cats to the vet, say for example. Then how do you actually do this is to actually discuss with your vet. I would really appreciate if you can actually discuss and talk to your vet about how you have how many cats, and then how you have done. Ask their advice on how you can actually manage. And then if you really need some medication, some of the medication like antihistamine and all that, they can actually dispense to you for other cats as well. Definitely antibiotic, and antibiotic especially we are very, very careful. Okay. The vet that is very careful and say no to you, please appreciate them. Don't scold them like, I just want a little bit, buy from you, so cannot man, how why you so far by, and all that. Please don't do that to them, because like what you say, enrofloxacin, especially to kittens, can cause blindness and also bone marrow suppression. Meaning, for that bit of reason that you do, and overdosing is it's a big thing for enrofloxacin as well. When they do that, it causes all of these problems that I tell you. You can actually just Google it, then you will have all the answer already. But from my side, I'm just telling you that have to be very careful in using, especially those wise, has to be very, very careful. Kittens is a no-no, yeah. No to use enrofloxacin in kitten. Please don't. Okay. Now very, very commonly people just sell azithromycin, doxycycline, the green tablet, the green flu tablet. Even they sell it on Shopee. Oh my god. Those actually we use to treat chlamydia. Okay. Who actually see this on Shopee before? Don't tell me you buy it. If you really buy it, you don't tell me. I will be very, very angry. I just want to tell you that those medication is actually not expensive. Okay, not really expensive. Talk to your vet, and then at least tell them that, dog, I really cannot bring all of them. Okay, these are the few that I can bring, but I have all these people with the photo and the weighing and the weight for you, and see whether you can do something for me. Some chlamydia cases that we do, right? Sometimes we also treat the whole group. Okay, because chlamydia spread very, very fast to all. So usually we will ask for body weight. So body weight for vet medication is very, very important. Okay, a 3 kilo or 2.5 kilo and a 5 kilo cat takes one take quarter, one take half a tablet. And if you give the half a tablet to the person, to the cat that need half, you will cause gastric ulcer, you will cause kidney problem. You don't see then because you see, oh, okay, symptoms good already. Wow, after give very good already. Then 2 months down the road, the cat has kidney problem. Then who do you want to blame? You cannot be putting the cat down and then you have to treat them. You have to spend a lot more money to treat them. Okay. We have one case that I saw, azithromycin, the white color solution. They just get it from the pharmacy, the human pharmacy, and then just keep giving. And the kitten that I saw that collapsing on my hand is actually 10 times overdose for that drug. And the diarrhea just don't stop. How to stop? Because you are 10 times, overdosing. All right. So it's bad. Okay. Wendy, did I answer your question? Okay. And then what do you recommend to use to disinfect bedding? Okay, bedding just now I have actually told you. So you can either wash it, you can actually wash it with a little bit of chlorine disinfectant. That's something that you can really do. Or second thing is, if you are a little bit lazy, you can actually use the paw spray. You can. Actually, what paw spray is just diluted chlorhexidine. It's also an antiseptic. Okay, you can actually do that. But if you have so many, let's say if you have 10, 15 cats, I don't think you really can actually spray that to everyone. You just put those things with a little bit of chlorine washer and put in the washer and wash, all right? And then dry them, then should be okay already. Towels and all that, you can do that as well. Okay, great. You can do, you don't have to do 1 to 30. You can do 1 to 100 to 1 to 300. Okay, it's still workable, because after they wash, you actually dry it as well. Great. Oh, great. It's already 1 hour. Anyone have any more questions? Anyone have any more questions? I give you a bonus. Anyone have any more questions that is out of this topic? is it okay that I mix antihistamine with wet food? Does it actually still bring the effect on? Yeah. If the cat finishes the cat food, the wet food, yes, can. Okay, Lenny. Okay.
Hello, doctor.
Yes.
Hello. Sorry, I mean I have few questions, so I prefer
Ah.
to to
Please.
directly open mic. I mean sorry, okay.
No problem.
First of all, I mean doctor, I would like to get some updates from you. This is out of the topic. First of all, is it that I mean because actually I'm running a cat hotel lah. Lenny is my colleague. Okay, and then actually I mean, recently we see a vaccine card from vets, right? Some vets that updated the vaccine card is every 3 years rather than annually.
Okay.
I mean,
So you want me? You
yeah.
want me to answer that
I mean,
first?
is it? I mean, is it the new update or anything? Because I mean, we have seen that two vet in Penang that currently is that their next vaccination will be after 3 years. It's not next year.
Okay.
Yeah.
This one is slightly more complicated to explain, but usually in why do we do a yearly vaccine is because the efficacy of the vaccine is supposedly last for a year. All right, so that's why you do a yearly vaccination. Some of the things will also last for about 9 months to a year only. All right, so what happened is in overseas, because of the vaccination, and they always vaccinate around the neck area, the neck skin, right? So because of so many years of doing with the adjuvant and all that, adjuvant means the things that making up the vaccine. They are actually causing a lot of cancer building sarcoma around that area. And because of that, they don't recommend anymore to actually vaccinate here. So as you can see, we always actually vaccinate near the limb. Okay. So if anything ever happen or growth ever happen, right, we just actually have to so-called amputate the leg. Now, even worse, not even worse, even the whatever the trend is now is to actually vaccinate at the very low part of the leg, which is very, very painful for the cat. Sometimes it's like near the bone. Okay, but to the explanation is that this is something new that they try to want us to encourage to, is that when you actually inject around that area, if anything happen, you just have to lose your leg. That's all. And now if you can see, right, the vaccination dose, instead of the one whole ml, now they actually reduce it to about 0.5. Okay, so when you give the injection, you use a smaller needle, it won't be that painful. So for your question about 3 yearly, this recommendation has been actually put up from WSABA. I can send in the group later on for that guideline. 3 yearly vaccination is usually in a really proper way of doing is that after you inject one time, the next year when you go for body check, so they still go for body check. So you go for body check. Sometimes they actually take the blood for antibody test as well. Okay. And then after that, if it is high enough, then they don't give up. But generally, out of 80% of cases that they do running this trial, 80% of them actually can have a high titer for more than 3 years. So that's the reason why they recommended for 3 yearly. Okay, I will be sending you that thing in the group. It is from WSAVA, World Small Animal Veterinary Association. Okay.
Now,
Answer the question?
yeah, thank you very much. Now my second question. Sorry, today I have few questions to ask. Okay.
Can lie. Everybody will learn with your question.
Okay, because I mean, from your sharing just now, right? Actually, you mentioned that the cat food is generally spread by direct contact between cats through saliva, everything, and also spread indirectly from sharing food bowl, bathing, litter tray, and human hands. But is it? I mean, this I mean just would like to do clarification. also cat flu also can, I mean, spread by air, is airborne, like they in the same, I mean, also will be sparing, like, I mean, if let's say that I in the same room with you, I flu, you also have the chance at getting flu, right?
Yes, you're
Okay.
right. You're right. They are actually the droplets of same like how COVID does. So when you hachi, the droplets that is from the clear nasal discharge, that's why it will come out. So that's why I want you to recognize whether they are just doing that hachi, 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 hachi. It's not like just irritation, or when they do that. When they do that, you separate them straight away, because that is how they actually blow out the viruses. Okay.
Okay. Thank you. I have my next question a bit. I mean, the question sound a bit silly lah. Okay. Please bear with me. Sorry. Okay.
No silly question.
Okay.
Go ahead.
Like, I mean, okay. Like COVID, right? If let's say that I carry COVID, I might don't have the symptom like after 7 days or 8 days. The COVID, the symptom only kick in like on 7 and 8 days, and then the COVID virus only can spread to people on that when the symptom come out. This is my understanding. Correct me if I'm wrong. Like cat flu, right? Sometimes that when we, I mean, since we are doing cat hotel, but when the cat coming to our place, okay, we see that everything is okay. We check,
Yeah.
and then when the second day and third day only hachu.
Yes. Especially in boarding, because they are stressed. I told you already.
Yeah. So if let's say that when the sparing when is the period they start to spread, is only when they hachu, right? They don't
Yes,
hachu,
yes.
they don't spread.
Yes. Okay, before they hachu, if they do that, so I need you to be more careful. When they come in, they start doing that, you already have to separate them. So
Okay.
you actually catch it earlier than before they sneeze. When they sneeze, if they have enough of that, then they sneeze.
So like this.
Before that, they will be doing that thing first,
Okay.
and then rub on the floor first. On those, you have to be more careful. And then you always have to warn the owner as well, because like how I say, usually at home they are quite okay, or they are some carrier, and because they come for boarding, it's not their own house, so they stress, and this thing come out. Usually, like you say, second, third day, it will show the symptoms, right?
Okay, understand. Okay, another question. I mean, is it? I mean, other than stress and then all the sensitive thing, is it possible that the air ventilation will be caused? I mean, if the air ventilation is not that good, also will cause the flu also.
Like I told you just now, the ventilation is very important to make sure that they are happy and healthy. Because let's say if they are always stuffy, right, then the immunity go down, then also can have. Or if the ventilation is not good and then the other cat has some issue, then they will also kena. So the ventilation is very, very important.
Okay.
Yes.
Okay, doctor, my next question. Sorry, I have a lot of questions to ask. Okay, doctor. Okay, I mean, okay, like for certain medication, like we human, we take medication. Some medication that we may cause us allergic. Okay, but my understanding that DMG is just a supplement. Is it possible that DMG will be causing allergic to cats also?
Very rarely. In maybe like a few hundred cats or few hundred cases, we might see one or two. This is from the report lah. All right, it's something like allergy sort of like me, when I eat vitamin C, I will have allergy. It's not really the vitamin C that is allergy, but I'm allergic to the compound that making up the vitamin C. So that is the kind of reason usually. So DMG itself usually don't really cause allergy, but whatever that we make it up, sometimes the cat can't have that. I mean, can't take that. Then you have to stop it, no? Then you have to stop it. Use some other thing. Because other than DMG, you have other things like animal draft, or even out of maybe how many cats do you see that has reaction?
No, so far no, because I mean currently I'm using DMG from PetMedic lah.
Right.
So far I mean there's a good result also, but some that I mean no result also got. But so far I don't see any allergic happen. It's just
Reaction.
this question is just a prevention question, because I mean sometimes we see that the cat like I mean not so healthy, or maybe that they start full they have a symptom
Or
of
you want to
food
help the owner to
Yeah.
do that.
Yeah,
You
because I
can,
mean,
but I would advise you to put in the note on your boarding form when they sign, give you authority to feed certain supplement.
okay,
I think it's a good idea to put that in, and they sign to agree to that
okay,
before you start doing. And then you can actually let them know what you're using. If they're comfortable, then you do. If they're not comfortable, then you don't. Because usually we start by helping people, right? But you do not know how sick is the cat. So if they have other things, let's say they have heart problem, like yesterday, a cat went for a shower or spa. 7-month-old British Shorthair went to a spa, and then after that, collapsed, and then sent to us. Sent to us is already nothing already, no heartbeat, no breathing, nothing. It's already all blue. But nonetheless, we still try to actually do the CPR and all that, but definitely we can't save the cat lah. Then the owner was telling us that the cat actually has heart disease and is under medication. So when we actually tube the cat, right, when tubing the cat, we actually see a lot of fluid coming out from the lung. So the groomer will, the owner is actually blaming the groomer. To be very frank, so they wanted us to put a report saying that it is from the groomer. So we can't do that because we're telling them that the cat comes in already died. So we won't know what's the cause of that. We advise them to go for postmortem. But when we put the tube in, right, we see the fluid coming out. So we suspect it could be because of the heart problem that he's already have water in the lung, which the owner doesn't know. And the pet shop also didn't know. They didn't see how the breathing is and all that. And then mandi lo, and mandi stress then die. So the same thing goes to you. Be very, very careful when you take care of other people's patient. I mean,
I also getting flu because I'm also stressed.
All right. So it's okay. I think what we do is you have a number. I more than welcome you to actually directly ask us from our community, so that other people in the community will also learn. But I just lost my phone 2 days ago. I'll try to replace it before we keep on chatting again. So thank you everyone for your time. It has been a very, very, very good. Okay. Sorry, Joey say we need a group photo. All right. So thank you very much, everyone. Do you actually learn something today? Do you? Everyone is asleep already. Okay, if you are comfortable, please switch on. Come lah, switch it on for me lah. Okay, cannot. Tak apa lah. I think everyone asleep already. Okay. All right, thank you. Okay, switch on camera. No one want to switch on camera. Prina, switch on camera lah. Let me know who you are. Come. Let me see your face. For group photo. Come, Jean. Very shy. Hi. Hi, Jean. Great. That's your cat. All right. Great, Angela. So I hope whatever that I share today will help you guys. Do whatever that you learn today, right? Please do share with your friends as well. I really don't mind you teaching a lot more of your friend about what we are sharing it here. And then one more update is that actually we have run some research with UPM. We also realized that actually COVID can goes to cat, but it just doesn't really have the symptoms and doesn't really goes to human. So that's kind of concluded with it. But if you do have cat and you have COVID, right? It's good to either get other people to take care of your cat or try not to take care on your own. All right, great. Thank you so much. Have you taken the?
Yes.
Okay, right. Thank you. Goodbye. Good night.